1920, as the world was coming to terms with the aftermath of the Spanish flu, the South African National Council for Mental Hygiene and the Care of the Feeble-Minded was established. Over the years, the organization changed its name a number of times and finally, in 1990, settled on the South African Federation for Mental Health. From the very early beginnings, SAFMH has been fighting for the rights of persons with psychosocial and intellectual disabilities while promoting mental well-being, community-based mental health care, and deinstitutionalization within a human rights framework.
SAFED is a federation of mental health organizations, and its strength is that, as Aristotle said, the whole is greater than the sum of its parts. Service delivery has benefited through the sharing of best practice, and in advocacy it's enabled the movement to speak with one voice. Happy birthday, SAFED.
We exist because of the people we serve. In one pandemic, in the worst of times, we have endured as an organization of professionals, experts and service users, determining the day-to-day management and unfolding the long-term vision. In this centenary year, the South African Federation for Mental Health continues to strive for non-discrimination, justice, equity, and the relief of stigma in mental health. Therefore, let us weave our thread well in the unfinished tapestry of mental resilience.
The passionate and inspiring leadership shown by past and current presidents steered SAFMH towards great accomplishments for the mental health movement.
And I'd like to say huge congratulations to the South African Federation for Mental Health on attaining the ripe old age of 100 years. It really is an amazing achievement, and particularly want to thank and acknowledge the South African Federation for Mental Health for all of their work, from sterling national level policy engagement on issues of mental health through to everyday provision for some of the most vulnerable members of our society.
Very, very best wishes to my friends at the South African Federation for Mental Health on this auspicious occasion of your centennial anniversary. You must surely be one of the oldest associations for mental health in the world. Never before has your mission been as important as today. For today we face a historic opportunity for reimagining and transforming the mental health care systems of every country, not least South Africa. And I wish you all the best, and I stand in solidarity with you, that we look at a future where we can embrace the diversity of experiences and strategies to address mental health in our communities. All the very best.
100 years of existence is a remarkable landmark for the SA Federation for Mental Health, who's evolved over decades in terms of new evidence, policy transformation, human rights instruments, and most importantly, placing people with psychosocial and intellectual disabilities at the center of it all. May the SA Federation for Mental Health in decades to come make an even greater impact on the mental health of all people in South Africa.
Working together with key national and international partners, our strategic advocacy efforts raise much needed mental health awareness to break the stigma and discrimination still experienced by persons with psychosocial and intellectual disabilities.
The South African Federation for Mental Health has set the standard for the South African mental health movement by advocating for the rights of persons with psychosocial and intellectual disabilities. The Federation is well known for innovative, groundbreaking advocacy campaigns such as the Right to Education campaign, the Rural Mental Health campaign, and the more recent Speak Your Mind campaign. I'm very proud that our organization is an affiliated member of the Federation that has a credible track record and always maintains good governance.
The South African Federation for Mental Health is the oldest national mental health organization. The South African Federation for Mental Health, now more than ever, has a very critical role to play as mental health challenges have been pushed to the foreground as a result of the COVID-19 global pandemic. Over the past 10 decades, the South African Federation for Mental Health has ensured that it has dynamic, proactive, strategic, innovative programs across South Africa to ensure that all who live in our beautiful country has access to mental health care. Sadly, 85% of South Africans still have no access to mental health, and so therefore now more than ever, the South African Federation for Mental Health is called to deliver the service that will reach into the hinterlands of our beautiful nation. And they've empowered mental health users across the land to have this voice, to advocate for those most vulnerable, and to ensure that their human rights are protected.
As the largest national mental health federation in South Africa, with 17 community-based member organizations in all 9 provinces, SAFMH functions at a strategic level, providing support to community-based organizations who provide much-needed social care, empower persons with lived experience, while working with government, calling for better investment in mental health.
On the board of the South African Federation for Mental Health, where I represent persons with a lived experience of psychosocial disability, and I've been on the board since 2017, and I've also been involved in activities of SAFMH. Being on the movement has afforded me enriching opportunities such as traveling experience, understanding meeting procedures, meeting new people, and it's also given me the platform to be self-confident and feel empowered. It has been a great honor for me to represent persons with psychosocial disability at the national level, and has given me a platform to be included and to address real issues that affect the quality lives of people with disabilities. Thank you.
Also, the experience has been good. The experience has been wonderful, being a changer, being a game player and all of that. And also the experience of being a person who now people look after or look into. It is quite an experience that has been very tough on me, because now I have to change my way of doing, the way of thinking and all of that.
We are proud of being part of its history, and we wish the beneficiaries, staff and management well for its future endeavor.
And as a department, we take this exceptional opportunity to congratulate the South African Federation of Mental Health on their centenary celebration. We have worked in close collaboration with the Federation to improve services and promote the quality of lives for persons with intellectual disabilities. I am certain that the organization has undertaken many other projects to provide a broad range of services and has evolved over the years in the attempt to promote and provide best quality of life for persons with psychosocial disabilities. We find ourselves in the COVID-19 era. The pandemic has had devastating consequences, and as a department, we recognize and acknowledge the ambitious, hard-working efforts of the Federation to address the consequences of this pandemic by developing measures and strategies to prevent and reduce these fatalities.
Thank you everyone for your kind wishes on the centenary of the SA Federation for Mental Health. Mental health awareness, promotion and advocacy is known to increase mental health literacy, improve understanding of mental health needs, and reduce stigma. There is much more to mental health recovery and rehabilitation than medical treatment within a health establishment. Health systems must address the social determinants of mental health in response to improving access to mental health services. As we look to the future, the SA Federation for Mental Health vision is to empower communities to attain optimal mental well-being, and quality of life in a just society is now more relevant than before. And so, as we celebrate this centenary, we step forward to strengthen our collaborations and partnerships, to advocate and lobby for health system change, to uphold the rights and the dignity of the communities we serve.
Congratulations on 100 years.